Welcome, Simon. How are you?
Not too bad. Happy Hurricane Weekend.
Thank you. Happy Hurricane Weekend to you. I hope, there's an Irish blessing about may the wind be at your back, but I'm going to make one up now, a Jewish blessing. May the wind stay out of your trees, therefore they will stand for much longer.
Well, with the last few storms, we've been steadily losing the weak trees. Hopefully only the strong trees are left.
Yes, hopefully. You're absolutely right.
You mentioned earlier about the Shriners.
Yeah.
My uncle in Montreal is a long-time hardcore Shriner, and I've had a couple of chats with him about it. One of the really interesting things that the Shriners do are the Shriners hospitals. And he's been involved in sort of raising, helping to raise millions of dollars for these Shriners hospitals. I think there's one in Montreal. I think they're putting up another one in Canada. And these are hospitals specifically designed for kids. And they're world famous for their burn units in particular.
Their burn units. Go on.
Burn units.
You mean for those who suffer from second or first degree burns?
Yeah, third degree burns, the little kids that, kids can be pretty foolish sometimes. Some of them get really badly burned in accidents. And the Shriners hospitals are the best spots to go if your child is in that situation.
Amazing. And the Shriners hospitals, are they located province-wide, or is it only in certain cities?
Well, I know there's one in Montreal. I don't know where else there is one in Canada. But they fly people, they'll fly children in from anywhere to go into their facilities. And my understanding is that it's all free. If you've got a seriously sick child or a seriously burned child, then, Shriners hospitals are the place to go.
That's fantastic. I got to say, Simon, I've been fortunate enough to not require the services of the Shriners Hospital, but I'm going to have a look into that. And thanks for bringing that to our attention. It's interesting how groups just continue to contribute to all matters of community, and it seems more and more that they are contributing to either fundraisers for particular types of cancer, research, or just general awareness around health. And I know that you have recently become an advocate for, now you're going to correct me here, but I think it had to do with rare diseases. And there's a particular lobby group with the federal government or for the federal government to help try and secure research or funding for, is it particular rare diseases or is it just rare diseases in general?
Well, it's funny you should mention that. Over the last couple of years, I guess, or pretty close, I've become an advocate for strategies in dealing with rare disorders, in terms of approval of drugs, in terms of access to the best doctors, in terms of better diagnosis, those kinds of things. A couple of weeks ago, I was in Montreal for a set of meetings, and I'm now the vice chair for a national patient network related specifically to a class of diseases called MPNs. Mm-hmm. And one of our goals is to do greater public outreach in terms of healthcare. And one of the issues that we see consistently is that the healthcare system is not very good at being patient-centered. And that's a discussion that's sort of missing in a lot of places. There are discussions with respect to particular diseases, to particular issues, to particular problems, but a holistic discussion on a patient-centered healthcare system is what we find has been missing. And something you need to consider is that healthcare is the largest single expenditure for our province and for any province in Canada. And this province in particular spends more money on healthcare per capita than any other province. So the question then becomes, are we getting what we pay for? Are we getting what we deserve? And are we getting what we need? So I'm putting together, and a group of us have been working together on this, and I mentioned it to Patty a few weeks back. We're putting together a public forum on healthcare, and specifically on the patient perspective. And it's going to be at the end of this month at Cannonwood Hall on October the 29th. And we're going to be putting more information out on this. It's going to be an evening thing around 7:30. And we have some questions that we'd like to have, public response to. How have you been treated by the local healthcare system? What has been your experience?
What do you think about that website that popped up about 8 weeks ago called Eastern Hell? Is this the type of thing that you're looking for, or are you looking for a more rational discussion?
Well, we're looking for a rational discussion, but I'll tell you, Eastern Hell is the extreme end of public frustration with the healthcare system. When you consider that doctors have people to speak for them, and administrators have people to speak for them, and the union workers have people to speak for them. for the patient who walks into the health science complex or walks into the Rollington Hospital or whatever hospital in the province, walks in not feeling well, who speaks for them? For too many people, the public health system is really sort of a black box. They're not sure how it works. They're not sure how it works for them. They're not sure how it works internally. They're not sure what to get what they need out of it. And this is the kind of thing that we need to address. We need to have a better educated patient population so that a better educated patient population in the long term can take issues and questions of their health into their own hands. It's about patient empowerment. And that's what we want to talk about, is how we can achieve a patient-centered system with better patient empowerment.
So you're anti-Kafka.
Well, I'll tell you, if the individual doesn't take these issues into their own hands,
yep,
nobody will do it for them.
Listen, and these are the words of strength and inspiration that do come from advocates, and of which you are one and have been for many years, and therefore we must listen. Just as we were listening to Graham Oliver, who is an advocate for not fracking. Clearly, if you want issues brought to the forum, which is the forum of ideas, which is public radio or community in any aspect, you have to make sure that you are articulate and know as many facts about your issue as possible, and you certainly do on this and many more. Simon, thanks very much. We got to go to our break for the news.
Just so I can reiterate very quickly, it's going to be on October the 29th. Wednesday, October the 29th at 7:30 at Cannonwood Hall at St. Thomas's Church, and it's the Healthcare Forum on the Patient Perspective. Okay, great. Simon, thanks for a very informative discussion. As always, have yourself a wind-free weekend, sir. Take care. Have a good day. Cheers. Bye. Bye-bye.